Good morning, sir.
Good morning.
How can we know you, sir?
My name is Dr. Nwabukwu Emeka.
From where, sir?
I'm a dental surgeon from Benin.
Welcome, sir. So what really brought you here?
I came for this Pro Health International Free Medical Outreach at Afikpo in Ebonyi State. Came here on Sunday and we're leaving tomorrow. Came to give free oral health care to the people of Afikpo and environs via Pro Health International.
Okay, sir. So what is your own area of specialization as a medical doctor?
Okay, oral and maxillofacial surgery. I'm an oral and maxillofacial surgeon in training.
Okay. So how many have you attended this morning, sir?
Okay, today I have done close to 10 extractions. I'm about to do excision of, I'm about to excise a lesion in a lady's mouth. So like this is my 10th extraction. But so far, I've done about 240 extractions from Monday till today. For the past 5 days, I've done about 240 extractions.
Okay, so what do you have to tell the whole world for this charitable work that is going on in Mata Hospital?
Oh, this is my first time of participating in Pro Health. Though I've been hearing of it before, but I've not had the chance to participate. This is my first time, and I must say this: I am really impressed with Pro Health, giving free medical care to the poor people around us is something that is awesome. Trust me, it's something that every Nigerian should try and do, especially those who have the means. It is a very good one, and I say more grace to their elbow.
Do you wish they should continue this program, sir?
Of course, it's non-negotiable. It's something that they should do more often. I would advocate for every 3 months, because right now, obviously, we are shutting down in the next 1 hour today, and you could see the number of patients outside waiting. I can't see them. Every day it's been like this, so it's disheartening to know that I can't see them. You could see their faces and they are all sad, but I can't do anything. But I really wish we could extend it to probably another 1 week, which still will not be enough, but at least. And I would beg my colleagues out there, doctors, nurses, pharmacists, to participate in this. I know there is no pay in it, that's why most people will not come, stay 1 week without pay. But it's something, when you give back to the community. I'm not from Ebonyi, I'm not from this state, but I am happy I'm doing something. I'm from Delta State, but helping people around here, it gives me joy. So I think every medical professional should at least take time out participating in such programs.
Okay, sir. Sir, did you have any complication in the case you handled?
Yes, just like 2 cases. And I addressed them impromptu, but I think it has been fair and good. Just 2 cases that I had a little complication.
You're welcome, sir.
Thank you very much.